Yeah, good morning. We can start.
Thank you so much,
Thank
sir.
you. Thank you.
With
शीतल
your
शीतल
permission.
मॅम
Yes.
आपल्याला ते हे चालू करावं लागेल युट्यूब स्ट्रीमिंग
केलं सर केलं.
आणि
लिंक
रेकॉर्डिंग
पाठवलं.
पण आणि रेकॉर्डिंग पण.
ओके.
Thank you, Dr. Vinod. Thank you, Dr. Manoj. So, good morning, everyone. We are celebrating a Medical Legal Protection Act Day on 17th of February. And to make everyone aware of this particular day, we have arranged this webinar with our esteemed faculty, Dr. Rajiv Joshi, who is not only a pediatrician but a lawyer and a very dynamic personality as far as the medical legal expertise is concerned. He's also a proposer and a founder member of Medical Legal Council of India. I welcome on behalf of Indian Academy of Pediatrics, Dr. Rajiv Joshi for this informative webinar. I also welcome our Secretary Maha IAP as well as the Executive Body Member Dr. Amol Pawar for this particular webinar. He has requested, he has accepted our request to be a chief guest for this particular session as a part of Central IAP Joint National Convener and for the IAP Action Plan, IAP Presidential Action Plan 2025. He is the Secretary General for Maha IAP and he will be guiding us to start this session. Dr. Amol Pawar.
Thank you. Thank you, Dr. Mahesh, for inviting me. Am I audible?
Yes, sir. Yes, sir. You're audible.
Okay. Thank you, Dr. Mahesh, for inviting me as a guest. And also, I congratulate President Dr. Manoj Jalte, sir, and entire Pune IIP team for arranging this much needed webinar with expert like senior pediatrician in this field, Dr. Rajiv Joshi, sir. Friends, as you all know, tomorrow is 17th February, and IIP and whole medical field across the world is celebrating it as a medical legal protection day for doctors. So this year, IIP's theme is medical legal protection, doctors' right of patient's benefit, and the slogan, legal knowledge, safe practice, shielding doctors, strong and active. As you all know, there are various common medical legal issues, and this our clinical practice not only demands the medical expertise, but also a keen understanding of the legal environment. And medical legal risks encompass a broad spectrum. However, some risks are more likely to occur than others. This happens when a healthcare provider does not meet the expected level of care, leading to injury and harm to the patient. And this may lead to disharmony between patients and healthcare setup or doctors. So I'm very glad that Pune IIP has arranged this webinar to teach all the pediatricians or teach all the doctors about its importance. So thank you, Mahesh, and over to you again. Yes.
Thank you. Thank you so much, Dr. Amol Pawar, for joining as a chief guest on today's webinar. Without further ado, I would like to welcome Dr. Rajiv Joshi. He is an MBBS, MD Pediatrics, and an LLB. Also, he is a visiting faculty for Health Informatics, Gokhale Institute of Politics and Economics in Pune. He is a past president of Indian Association of Medical Informatics. He's a health data interoperability professional certified by HL7 and SNOMED City International. He has a fellowship in biomedical informatics and a National Library of Medicine USA. He's a founder, proposer, and medical of a Medical Legal Society of India, Pune, Maharashtra, India. He's a chairman and for e-communication cell of Indian Medical Association. He has a computer application in medical profession, Take My Care Private Limited, and then he's an adjunct professor of biomedical engineering, Department of Instrumentation, COEP, and he's a founder professor of Department of Health and Information Technology in MUHS. He's also trained at Duncan Guthrie Institute of Medical Genetics, York Hill, Glasgow, and he's trained at Interdisciplinary School of Scientific Computing, SSPU, Pune. He is running a Sri J hospital at opposite Chintamani Nagar, Bibewadi, Pune, India. So I welcome Dr. Rajiv Joshi for this webinar. Over to you, Dr. Rajiv Joshi, sir.
Good morning, Mahesh. Good morning, Dr. Amol.
Good morning,
thank
sir.
you for having me on this program. First of all, let me congratulate Indian Academy of Pediatrics for arranging this program on Medical Legal Day. This is a very good concept. Doctors have been celebrating Doctors' Day and whatnot, but now today we are at a position where we have to celebrate Medical Legal Day. It is unfortunate, but it is the reality of life, and we have to understand various aspects of medico-legal issues that crop up in our practice day to day. And most important issue which I have been handling personally from 2020 is about the violence, about which I will speak in the beginning. And afterwards, we will discuss about certain medico-legal problems that we face as a pediatrician or as a general in any other specialty of medicine. So I would first like to congratulate IAP and then start my presentation. So first we'll complete the presentation and then we'll have a question answer session, and in that question answer session I'll elaborate more. But I am very happy that IAP has taken the initiative, and Medical Legal Society of India is conducting a training program for certificate course on law and medical profession for last 2 years. We have completed such 5 programs and we have trained more than 200 doctors in this program. And 6th program, I'm happy to tell you that even before this medical legal day was announced, Dr. Mahesh and Sharad and Dr. Kankriya, they discussed with me and they have collaborated with Medical Legal Society of India for this session, and 5 pediatricians have joined this program from IIP, and we will continue this association further because we continue to have these programs again and again, back to back for 13 Saturdays. We have program with 52 lectures from 2:30 to 5:30, question answer session followed by it. And then again on 14th Saturday, we start the first session. That is how Medical Legal Society of India is working relentlessly to educate people on medical legal aspects. And I am sure that I cannot cover everything in today's 1 hour lecture. We'll just go through what are things are required. First, start with violence. So violence is the main issue that we face, which is a physical violence or verbal violence. And what is required to be done for that? Let's see in this particular presentation, handling violence at ground zero healthcare institutions. I'll just switch off my video so that it doesn't come in the way of rendering the videos, as well as reduces my bandwidth. So just to introduce myself again, I am Dr. Rajiv Joshi, MBBS, MD, LLB, founder member, Medical Legal Society of India, and I have filed petition, criminal petition PIL 2332 of 2020 in Bombay High Court for the cause of violence against doctors, and we demanded that the act of the violence against doctors should be changed. So today, 16th February, I welcome all the members of IAP Pune for this lecture, and I thank you all for inviting me for this program. So let's see what the medical profession faces. What are the problems? One problem is violence, second problem is allegations of negligence, and third problem is accidents which happen in hospital which nobody realizes that doctors do not intend to cause harm to the patient, but something happens which is to be taken as accident. But unfortunately, there is no legal definition of accident anywhere in the government made laws or even judicial pronouncements, except for a few judgments which talk about this medical accident, which includes the judgment in Martin D'Souza as well as Jacob Matthews. And this Martin D'Souza judgment is the cause of this today's medical legal day that I am aware of. So let's see about a medical accident also. But before that, let's understand the proportion. So 75% of the doctors face violence sometime in their life. That is what IMA study says. It may not be physical violence, but patients pressurize, patients call, they put pressure, they call gundas, they go to police station, file frivolous complaints, and all that amounts to emotional violence also. And there are cases against doctors in which previously only 2 to 3% cases were proved against doctors, but now more than 25, or rather now recently it's about 30%, 35% cases are decided against the doctors. So be aware that you are not negligent in practice, and we'll discuss about something about negligence little after that. And accidents are 0%. Now, this is the major problem, that nobody understands that something happens in the hospital is medical accident and not medical negligence most of the times. So my goal of life is to change the situation, violence to 5%, negligence to 5%, say that it is accident 90%. And I'm requesting all of you who are attending this program, whether on this Zoom link or on YouTube, that please, at any moment in your hospital, there is some mishap, say that it is accident. Let somebody else prove that it was negligence. You have to say that it was accident, and you will be able to prove it that it was accident most of the times. So what we do, we are pediatricians, and what we know is prevention is better than cure. That's why most of our work is in vaccination and we prevent illnesses. And I personally, having practiced pediatrics for 30 years and still doing it, I know that initially my major income was through treating diseases. Now today my major income is through vaccination. Let's call a spade a spade. I have seen cases of tubercular meningitis. I have seen cases of empyema following measles. I have seen cases of post-measles encephalitis 30 years ago, 20 years ago, not in the last 10 years. I have not seen single case of pyogenic meningitis in the last 10 years because of the vaccination that we are doing day in and day out. And every patient comes before us, we first check whether he has taken complete vaccination or not, because prevention is most important. Similarly, for handling violence in our hospital, prevention is most important than handling situation, which is a major part which people are doing today. And then we have to take some action against the violence or perpetrators of violence. And my philosophy is we have to increase action on prevention and we have to increase actions on the perpetrators so that the situation of handling violence at ground zero, that ground zero is your hospital, your clinic, your institution where you are working. And there we need to do something. First prevent, then take action so that situation reduces. Now increase prevention so much that you don't have to take action also, and there is reduction in the situation. And I want to tell you how to do that. But before that, what are the causes of violence? Because before we understand what are the causes of disease, we cannot produce vaccine. Why this particular disease happens, we have to understand the cause, we have to make a diagnosis, we have to know the etiology. That is what we are trained in medical school. So I'm training you what are the causes of violence. Causes of violence are as follows. Patients have suffered some loss. Believe me, I have not heard of a single case where patients or their relatives just came to the hospital for the heck of it and started beating the doctors. I have not heard even once. Patients have suffered some loss. Let us keep that in mind. And therefore, we need to understand that the person who is angry against us has to be handled compassionately. Talk to him politely, talk to him properly. Don't beg mercy, but ask him what is his grievance. And most important is why patients are coming to you for the first place in the private sector. They are coming to you because Maharashtra healthcare budget is just 4%, poor quality of emergency treatment in private government hospitals, high workload in government hospitals, lack of resources like blood, oxygen, etc. We have seen this during COVID, and increasing intolerance in society and political interference. Therefore, patients, doctors in government hospitals are not able to give proper treatment. Therefore, they come to us in private hospital, and then our workload increases, and then maybe we are also going through same situation that we don't have the resources. We have to get blood from blood bank. We will not have oxygen at a particular point in time because with patient load, some administrative issues. So we have to understand that the patient has suffered some loss, and they do not understand whether the patient had problem as natural course of disease or complication of illness, or it was a doctor's mistake, or it was accident. And we also don't say that it is accident. Therefore, the patients say that it was done by the doctor as a negligence. They do not have quick remedy from anybody. Your hospital doesn't take their grievance seriously. Police take money from both sides, I'm very sorry to say. And judiciary, from my own example, I can see 2020 case was heard up to 2021 till the Chief Justice of Bombay High Court, then Mr. Dipankar Datta took interest. After 2021, for last 3 years, the case has not come up on the board also. And the day before yesterday, I went to the court saying that please hear us. They said, what is the urgency? We are dealing cases of 1995, 1996. That is the attitude of the courts. And therefore, since the patients also don't have quick remedy from the loss that they have suffered, they resort to violence. It is unjustifiable. It is immoral. It is illegal. They should not do it, but they do it because they want immediate retribution. They have lost something, they want to get the revenge. And that is unfortunate thing that is happening in the society. And the effects of this are young doctors are not joining government services. There was a petition in High Court of Bombay filed by Chief Justice of Bombay High Court when 34 patients died in Nanded and 11 patients died in Aurangabad. And the Chief Justice asked why these patients are dying. The government leader said that because private hospitals are referring serious patients to government hospitals, therefore they are dying. And the Chief Justice said, nothing doing, you have to treat patients, tell us statistics about it. And we produce statistics that only 50% vacancies are, or 50% occupants are, doctors are appointed in the, and 50% are vacant. Therefore, young doctors are not joining government service because rising violence against healthcare professionals, number of posts in public hospitals lying vacant, negative impact on well-being of healthcare staff. So 50% doctors work for 100% doctors, so they do double duties, nurses do double duties, and therefore they are having negative impact on themselves. And there is no job motivation for the doctors working government service. More than 35% doctors have become fearful. They have developed anxiety and lost motivation. This is not my study, it is study of Sehat and Mard. And there is a worsening of doctor-patient relationship over a period of last few years. And if this continues, then brilliant students may not opt for medicine. My son would have got easily walked into medical college, but he just refused. He said that I don't want to live your life. I'm seeing the way you are working day in and day out, treating patients, and still patients coming and fighting with you against the bills. Fortunately, I have not had an incident of violence, but fighting against the bills is day-to-day practice, which he, as a child, has seen happening in our hospital. And he said that I'm just not interested in this. I will go to BITS Goa. He became B electrical and electronics with MSc biological science, and believe me, he's working in medical instrumentation. And I have not entered into COVID world because of I am over 60 and I am having diabetes, but he has applied his instruments to COVID patients and treated COVID patients 100 times more than what I have seen. So the brilliant students will not opt for medicine if they have passion for it. And that is the study of Journal of Health Research and Review. And then what happens is the doctor-patient relationship is changing. Patients visit doctors for some element illness problem. Doctor treats the patient and takes his fees for treatment. And then what happens? Patient is cured and is happy about treatment bills. Patient is cured but unhappy about treatment bills. Patient not cured but happy about treatment bills. And patient not cured and not happy about treatment bills. So there we are producing two types of parties: happy patient party and unhappy patient party. And then this unhappy patient party has got so many recourses for to his to resolve his issues: civil court of the district, medical council of state or center, national human rights commission, national commission for women, local health administration, state health administration, consumer forum of district or state, criminal court of the district. However, they go to politicians, they go to police and put pressure on you, or they can indulge into violence against healthcare professionals. That is the unfortunate thing, but that is what is happening today. And therefore, we need to learn how to prevent this happening with us, every one of us. Please don't think that this is going to happen in someone else's hospital. It can happen to you in your hospital, in your setup, your clinic, your hospital, your institution. Therefore, we need to know what is to be done about it. And we are going to discuss what is to be done about it. Now, this is a picture in which the people with helmet are all lawyers. They are lawyers from Pakistan. What is happening is patients and their relatives are ransacking hospitals, threatening staff, grievously hurting doctors. Government hospitals, even in Pakistan, are poorly funded, poorly staffed, poorly protected, and 3 patients die as 250 lawyers are charged over ransacking hospital in Pakistan. Fortunately, we are just not there till as of today. Lawyers are behaving themselves, but the day is not far. If we don't do something about it, we are going to be in the same situation. So, vengeance replaces logic. Doctors and hospitals are attacked by a mob. People they don't get speedy trial. They lost faith in judiciary. Police does not take cognizance of attack and they take money from both sides. Doctors feel they do not get justice. At the same time, are court deciding the things right? 75% cases are in favor of the doctors. Keep your hand on your chest and say that you have not made any mistake or you have not been negligent in your practice anytime. It may not have caused harm to the patient, but I have at least 10, 20, 15 examples where I came to know afterwards that yes, I should have done something different. I should have done better. 25% cases are decided in favor of patients. We all feel that these all 25% cases are decided incorrectly because doctors have not done anything wrong. And therefore, the importance of the word medical accident is to be understood by each and every one of us. So what do? So we talk about the situation. Right now, we talk about, I said, what is to be done for prevention. You have to understand all these things. You have to keep in mind. You have to be compassionate with the patient. But when the situation comes, this is the situation. You got a flat line in your hospital, in a pediatric patient or a surgical patient or patient in the ICU. And now you have to do something about it. What can you do? You can't do anything as far as treatment of the patient is concerned. But you have to do CPR for 90 minutes Believe me, there are references which say that do CPR for 90 minutes, even though some hospitals do it for 20 minutes or some hospitals have policies of 45 minutes. There are references which talk about 90 minutes. And we have heard stories that patient was declared dead, and while he was being taken in ambulance, the ambulance went into a pit, and then the patient immediately, got awakened, and he was not actually dead. He was having this sojourn syndrome or whatever they call. So you have to now understand that first thing is don't blame anyone in the hospital operation theater at the time of mishap. You are not going to raise your voice, you are not going to cry, you are not going to talk to anybody in this manner that you are responsible. All of you have to say that whatever has happened is an accident. The sisters, nurses, ward boys, ayas, maushis who are roaming around in the theater will go out and talk about it, and they will say that there was an accident inside. If the surgeon says that anesthesia is double dose of anesthesia, they will go out and say the anesthesia double dose de diya. If you say that there is an accident, they will go out and say there is an accident. So you have to first mind your words and mind your tone and mind your language and say that it was accident and not blame anyone else. Anesthetic should not say that surgeon, you have cut the vessel and the patient has bled. Surgeon doesn't want to cut the blood, so he got cut. He will try to improve, but if the anesthetic shouts, "Oh, what you are doing? You have cut the vessel," the world will go out of the theater and they will say that doctor has done negligence. So please, do not blame anyone in your hospital because things happen. Patients have luck, doctors have luck, and they are coming to you for treatment of a disease. No healthy person is coming to you for treatment, mind you. So therefore, we have to say that it is medical accident. And then most important is breaking the news. Here, communication skills are extremely important. Give information to the relatives regarding cause of becoming serious in language they can understand. For example, old age, infection, high blood pressure, cardiac arrest, hypotension, whatnot. Gradually, step by step. That is why I've taken this diagram, which shows that you have to scale up what you are telling the patient step by step, one by one, 15 to 20 minutes apart. And remember this, that when politicians are serious in the hospital or they are in coma, big hospitals have got this daily bulletin, tell the people that this is happening, that is happening, now he's becoming okay, now he's becoming serious, now his kidneys are not functioning, now they have started functioning back, this and that, back and forth, till the time the politicians tell that situation is under control and now you can declare death. Believe me, this happens. And this has happened in the case of one Mr. Vanjali from Pune, who died in MRI machine in this Joshi Hospital MRI center. And the commissioner of police told him to shift him in the ambulance to Jahangir nursing home. And the ambulance with the corpse, but two doctors, one putting the oxygen, one doing cardiac chest massage, went from Joshi Hospital to Jahangir nursing home. And that entire ambulance was followed by hundreds of people on motorcycles. And then what happened was in Jahangir nursing home, police had created this barricading and they took only ambulance inside and kept everyone else out. And they prevented any violence happening in Joshi Hospital or the MRI center as well as in Jahangir Hospital. That is how things have to be handled very professionally, for which police have to be, we have to take cooperation from the police. Involve relatives in the action. In case it is related to excessive bleeding, shock, hypotension, septic shock for that matter, relatives can bring a bag of blood from the blood bank where arrangement is already made, or you can send a sample saying that please send a bag of blood. It helps to create additional supporting evidence of efforts taken by you. This we are saying but use this time that patients will spend for getting blood back to your hospital to do certain things to protect yourself, and I'm going to tell you what you have to do about it. So if cardiac rate is not seen on the monitor even after 90 minutes or as per the protocol of the hospital, prepare to inform the relatives about the unfortunate date of the patient. This is very important. You have to prepare to inform. And now that moment is going to come. But before that, remember this slide. This slide, can anyone say what is this slide about? Can anyone tell me what is this slide?
Swadesh movie, final scene.
It's not Swadesh.
No, sorry. Chak
Chak
De
De India.
India.
What does Shah Rukh Khan tell people?
This is your last game and play as if this is your last day of life or something similar like that.
वो 70 मिनट आपके जिंदगी से कोई निकाल के नहीं लेने वाला है. So replace Shah Rukh Khan with Dr. Rajiv Joshi. and refresh this team with all of you. And remember that वो 90 minutes आपके जिंदगी से कोई नहीं लेके जाने वाले, because in those 90 minutes you are going to work on medical legal aspects of this death which has happened in your hospital. Remember this. Though those 90 minutes or 45 minutes or whatever time your hospital policy is there for CPR, you are going to improve the quality of the documentation that is there in the case, and that will help you, because you will invite senior doctors from the institute, friend circle, professional associations, IMA, local association of doctors, IAP people, medical legal group, medical legal association of India, whosoever may be able to help you. Ask them to come to the hospital. Let them check the case paper that you have prepared, right from the diagnosis, not only diagnosis, reason for making diagnosis, based on what investigations you reached a particular diagnosis. Say patient was going to be subjected to appendicectomy, then why you made the diagnosis of appendicitis, then why you decided to make a surgery, and then during surgery what you had done, and then during CPR every 5 minutes what you had done, which drugs you have pushed, what, whether you have given the massage, whether you have given the defibrillation, all that you have to write. You have to be sure that everything is recorded properly, systematically, sequentially by the people who did it. And one person should be monitoring all these things, because finally this case paper is going to be your evidence in the court of law. You will not speak in the court, your advocates will not speak in the court, in the court only documents speak. Therefore, this document should be complete before you inform the relatives about the death of the patient, and before you do anything else, inform the police that a patient has died in your hospital, and please send somebody from the police department to take care of the situation, as well as you can take care of the body if you want to go ahead with the postmortem. You don't utter the word postmortem, but you inform the police that the patient has died, and whatever is required to be done, let it be done by the police. I have intentionally colored this in the uniform of the police, because one man in uniform is better to handle situations of violence than 100 doctors in aprons. Because 100 doctors in aprons will not do anything which one policeman can do in your hospital. And then this is one example of private security, in which it is Bombay Association of Medical Consultants has deployed 6 such team of 3 bouncers each at the periphery of Bombay, and within 9 minutes to 10 minutes from anywhere in Bombay, the call comes, these people rush there, and after that ambulance having 20 to 30 such people also reach the hospital. Now what do they do? I also was under the impression that they go there and beat the relatives. They don't do. They stand between the doctor and the relatives, and if the relatives beat them, then they beat the relatives. Till that time, they're trained to be calm and quiet and patient. And the moment they see that such people are there, relatives will not do any violence with the hospital staff or the doctors. But better to have a police in uniform, because he has got legal sanctity. You want to, pull up a gun and put it on the head of the perpetrator of injustice. So, also in every hospital, this is not from my own idea. There is a reference to this, and you should have a 4 feet by 10 feet table fixed to the ground, chairs fixed to the ground in a 10 by 10 room, which has got one entrance for relatives and patients, relatives, one exit door for doctors and counselors. In the other corner, you should have CCTV camera, and there should not be a single movable object in the room, like paperweight or a stapler or something, which the relatives can take and throw at you. In this cupboard, please have this pepper spray, so that if somebody jumps from that other side chair to your side chair, you can use the pepper spray, and then you can exit door and get out of this. Running away from the violence is not, being afraid. You have to protect yourself. In spite of doing all this, you have to also break the news of the death of the patient very patiently, preferably treating surgeon and anesthetist or the treating doctor, treating neonatologist, treating patients who does the counseling every day, if possible the communicator or the spokesperson of the institute, because they understand what language to use, and anticipate reactions of the relatives and handle them well. So you be prepared for the shock, pain, anger, guilt, depression, etc. And they will feel that why they got the patient to you. Well, they should have gone to a better place. They'll get depressed, but that depression, that guilt will convert into action, which will be violence by the patients. So be prepared for it. And then remember this IPC section 96 thing done in private defense. The thing is an offense which is done in the exercise of the right of private defense. Right of private defense cannot be said to an offense in return. So if finally you have to hit back, you hit back. Don't bother. Hit back. First save yourself, hit back, and then we'll see what is to be done about it. Because you cannot be charged for offense if you retaliate with the patient. Now, these are the sections we should always remember. You can just take a picture of this slide, or I will send this slide to IAP Pune. You have to say in your defense that this was accident in doing a lawful act, section 80 of IPC and section 18 of BNS. You have to write these sections in your defense. Okay? Tell the police that in my hospital accident took place, which is as per section 18 of BNS or section 80 of IPC. Act likely to cause harm but done without criminal intent. I did not have any criminal intent while treating the patient. I wanted the patient to recover, but this has happened. The patient has died. What can I do? It is as per section 81 of IPC or 19 of BNS. Act not intended and not likely to cause death or grievous done by consent. I have taken consent of the patient for the surgery. I have taken consent for the patient for keeping the patient in the incubator. I have explained that I'm going to do exchange transfusion. I have taken consent. The patient second, I can't do anything, but it is under section 87 of IPC or section 25 of BNS. Act not intended to cause death done by consent in good faith for the person's benefit. Act done in good faith for benefit of child or innocent person or by consent of the guardian. Act done in good faith for benefit of person without consent under section IPC 8292 or BNS 30. If there is nobody to give consent, and the child is in front of me and the patient is in front of me, and I have to do as per Parmanand Katara's judgment that it is duty of the doctor to treat patient irrespective of any law of the country. It is my job to treat the patient. No consent is required. Nobody else can say that the patient needed treatment but me, and I have treated. Only thing is you have to document why you took that decision, and your document will be sacrosanct. It will be gospel truth. It will not be challenged by anybody because you did it when you wanted to do it. You had to do it, and keep this Parmanand Katara judgment in your drawer so that you can give it to the police. You can say that I have done it this as per section 92 of IPC or section 30 of BNS and as per Parmanand Katara judgment, which is I am producing herewith along with my statement to the police. You have to be legally savvy. Okay, so to prevent violence, Kerala Private Hospital Association versus Kerala State had filed a petition and the High Court directed government to take inputs from all stakeholders, including Kerala Private Hospital Association and Kerala IMA and any other associations. Believe me, IMA Kerala did not do anything. This news came into the newspaper. I contacted them and they decided to file affidavit. I sent them entire document which I had filed in the Bombay High Court. Their lawyer said that we are not going to file such a strong petition. We are going to say that doctors should improve their communication. I said, what the hell? Why you should say that doctors should improve communication? You should say that this is the legal protection that you want. And I told IMA Karnataka not to file affidavit, and I filed affidavit on behalf of Medicolegal Association of India as interlocutory application, offered several suggestions, which amendment required in Kerala 2012 Act, and court ordered Kerala government to look into the sessions after 8 minutes of my argument in Kerala High Court. And the court directed that there should be a golden hour. Police should file FIR within 1 hour of receiving complaint of the violence. This was in December 2022. After unfortunate death of Dr. Vandana Das, who was stabbed 11 times on 10th May at 4:30 in the morning, the court held urgent hearing at 2 in the afternoon, and Kerala IMA advocate requested me to argue on behalf of Kerala IMA, and I argued at that time, and I told the court that this is the situation where the police are seen running around in the hospital because they were afraid of the perpetrator of violence, but this girl has lost life, and Kerala government has promised that they will change the act, but they have not done. So they directed the police to offer protection to government hospitals by providing state industrial security force, and private hospitals have shown willingness to pay SISF in High Court as directed by police to prepare terms of such security. But they also asked the government whether they are going to bring in the Protection Act or not, or improve the act or not. And the Kerala government advocate said that give us 1 week's time, and within 1 week they or passed the ordinance, and the ambit of Act was increased. Paramedical workers and administrative staff also included as per our request. Faster investigation to be done, not below the rank of police inspector, to be completed within 60 days from the FIR. That is also accepted. Trial should be expeditious. Special court and prosecutor to be completed within 1 year, filling which reasons in writing to be given by the judiciary. And the most important thing was there was graded punishment added in the act, including verbal abuse, punishment up to 30 days or up to 10,000 rupees, physical violence punishment increased from 6 months to 5 years, and 50,000 to 2 lakhs. Grievous punishment increased from 1 to 5 years and 1 to 5 lakhs. And damage to property, the perpetrator of violence have to pay twice the loss sustained. With advent of this act, Kerala violence has come down to 75%, because that is what we have to do. We have to change the act so that there is a deterrence of the act. Now we have filed in the medical legal society also has filed intervention application in Bombay High Court. We'll show them Kerala orders. We request strong act for Maharashtra. Unfortunately, the case has not come up for 3 years and we can't do anything. I tried, as I told you, I tried to go to before the chief justice and they said, what is the urgency? So, I mean, I can't argue what is the urgency. I told them life of doctors is at stake. They said, no, you are coming here for publicity. You want your name to be coming in the newspaper. Now, what can I do? I mean, I can't go beyond Chief Justice's wishes and desires. So what we are recommending is definition of medical accident should be there in all acts or in some act or some resolution or some government resolution that patient who was reasonably evaluated to be fit for planned surgical medical procedure with or without anesthesia dies in 24 hours of minor surgery, 48 hours of major or 72 hours of supra-major surgery of starting procedure or surgery as per HOTA Human Organ Transplant Act, or suffers significant trauma, injury, damage to brain or other body parts in unforeseen manner, suddenly, unexpectedly, and unintentionally, due to reasons which can be attributed to abnormal host response, or reasons which are unexplained, or reasons which cannot be attributed to normal course of the disease, or reasons which cannot be attributed to negligence of the healthcare providers or professionals or its staff, or reasons which cannot be conclusively determined even after post-mortem examination, will be termed as medical accidents. We have covered an exhaustive definition after discussion with medical legal experts. And there should be differentiation of negligence and medical accident. Therefore, you have to remember that violent attacks against doctors are increasing day by day. Reason is there no deterrent law against the perpetrator of violence. Most of the time, the accused let go under the provisions of attack at the spur of moment. Every time there is death of a patient, if there is reaction at spur of moment, it will be difficult to practice. Epidemic Disease Act, as amended 2020, provide for presumption of offense means that when somebody enters my hospital and meets me, that means he presumed to be guilty. Such provisions in addition to graded penalty should be included in acts for prevention of violence. And this is the goal of my life, to reduce from high violence to low violence. But for that, we need move from weak legislation to strong legislation, civil criminal judiciary to tribunal, fault insurance to no fault insurance, government protection to private protection, and finally, you have to take consent. You have to also take consent of refusal of treatment. You have to report violence and then track the cases and take them to logical conclusions. Don't be afraid of filing complaint in the police, because if there is necessity of violence in 100% cases, doctor said that 950 responses. Believe me, this is only research I have done. It is 100% people that there is necessity of doing something about violence against doctors. How many people filed complaints out of 34 responses who had violence against them? 44% said no, we did not file police complaint. 55% said yes, we filed complaint. Those who filed complaint, the police filed FIR, arrested the miscreant, kept in police custody, but finally nothing happened to them. At the same time, after of filing complaint, there is no use of filing complaint. That is what 82% people feel. Do not have time to pursue. That is what 41% people feel, and do not have money to pursue. You don't have to spend any money. The money has to be spent by government. The public prosecutor will be controlling the case. All that you have to do is follow the public prosecutor, follow the police, and then get some outcome, maybe 3 years, 4 years, 5 years, but that outcome has to be there for the violence against the doctors. So, role of law is Article 19 is affected because your professional integrity, your right to profession is affected. Role of law is Article 21, right to life of you as a doctor is affected, at the same time, right to life of other patients is also affected. So obligation of state is both ways, is negative. Obligations, prohibition of arbitrary deprivation of life of every person, as positive obligations to take appropriate steps to improve quality of life. Then the situation is very alarming, and we have to understand this table that I have compared acts of 19 states in the country, in which various clauses are there in some acts and some there are major clauses are not in. Don't need to go into detail because I have done a lot of research on this, but you can just see the color diagram in which N is no and S is Y is green is Y, and therefore you need to have a congruent law for all states in the country. Therefore, we are saying that there should be central act so that all the countries, all the citizens are treated equally, and all the doctors who are suffering violence are also treated equally. Unfortunately, they don't understand that hospitals and maternity homes are protected, but clinics and dispensaries are not protected. Violates Article 14. Doctors and nurses are protected, but administration and accounts and medical stores and canteens not protected. Also violates Article 14, and therefore our right to equality has to be secured. And government says that it's a federal structure, each state will make their own law. So therefore, Maharashtra doctors cannot claim same protection as of right with the other countries. But fact remains that healthcare workers of Maharashtra are treated unequally from other states. Hence, we are asking improvement in the act, and we are requesting the central government also to do the central act. So this is a statistic by Dr. Neeraj Nagpal, who is convener of IMLAG, and he has said that Maharashtra has got highest incidence of violence. And mind you, all of us who are practicing Maharashtra have to be aware of this fact that this is a very high risk state. In Maharashtra, when I filed my case, they said that there were only 302 attacks of assault on doctors, and accused were arrested. 445 accused were arrested. We said that this is wrong statistics. We'll produce it from the High Court or the police, and we filed the RTA, and we got this reply. 13 and 381 accused were charge sheeted, out of which only 4 were convicted. See the poor, conviction rate. Not even 1%. See how poor conviction rate is there. So we have to really fight out these cases. We have to file FIRs. We have to pursue the matters and then take them to logical conclusions, without which we will not succeed in preventing violence against doctors. There are shortcomings in all acts. Repeat offender is not punished. Frivolous complaints are not punished. Administrative staff is not protected. Private work is not protected. Non-medical work is not protected. Support to agents is not protected. Attendance of the patients are not protected. Because they may be the people who come to rescue of the doctor, but if they are beaten, they also should be protected. And vehicles, medical records, etc., should be protected. And then there is the role of judiciary. As I said, Parmanand Katara judgment is there, which says that it is your duty to treat patients, accident victims, or emergency situations, irrespective of whether they are paying money or whether there is legal issue. Legal issues can be set aside. Save Life Foundation judgment says that you have to help accident victims without any botheration of being exposed to harassment by the law enforcing agencies, and you should not take one consent of the people who get the patient to the hospital. You must treat. We must treat, sir, but what about our protection? You don't protect us by, the judiciary doesn't protect us. The Jacobetti judgment said that no arrest of doctors without expert committee report. There are hundreds of cases where doctors are arrested without expert committee reports. Martin D'Souza judgment said no mention is sensible provision not to arrest doctors. Every time there is a mishap in the hospital, doctors are harassed. There is no protection from judiciary regarding medical negligence as well as regarding violence, except the statement by the Gujarat High Court saying that doctors are personifications of gods on earth. We are saying, sir, we are not gods, we are human beings, but we need protection like every other human being, and we are life and death situation every day. Can you please mute the people who are talking? Please mute all, except me.
Mute all. Sorry for the inconvenience, sir. Please.
No, it's okay, perfectly ordered. I can understand. So Gujarat High Court said that doctors are personifications of gods, and we are saying we are not gods. We are human beings, but we need protection like any other person. There is a judicial pronouncement regarding physical violence and Destruction of Public and Private Properties Act, AR 2009. Mental violence is described in Usha Badri Poonawalla versus K.K. Korean, AR 2002. Economic violence is described in Soma Suresh Kumar versus Government of Andhra Pradesh in year 2013, structural and preventive measures in Condolar Film Society. This is Padmavat case, violence after Padmavat film release was there, and the Supreme Court has produced 30-page guidelines of how to prevent violence. And we are saying Padmavat is happening every day in some hospital or rather in the state or the country. Please protect with the guidelines of the court. But since the doctors are not united, since IAM is not pursuing these cases, since we are, happy in our own practice, our own hospital, and our own cell, that we don't come together to fight these cases. Therefore, we don't get this, and we cannot spend the kind of money the Condolar Film Society can spend. That is unfortunate part. Therefore, we are suffering. The security is pronounced in Ramesh versus others in state of Haryana, and witness protection scheme is pronounced Mahendra Chawla. We have to take significant input from all the judgment and try and protect our rights. So Scheduled Caste and Scheduled Tribe Act says that discrimination has to offense, knowing that somebody is SC/ST. If somebody does something, then there will be forfeiture of property of certain persons, as well as punishment of neglect of duties. The police don't act, they will be punished. Similarly, if against the doctors, SC/ST are 33%, let's say one of each category is 10%, so 10 out of 100, we are 1 out of 1,000. We need more protection than anybody else in the country. Therefore, we should be protected by the judiciary as well as the police. But nobody listens to us because as a voter, we have nothing to contribute to the legislatures. The role of police, response to call, record FIR, effective investigation, conduct trial, and effective measure to prevent violence. They just don't do it. They are busy taking money from both sides. Role of hospitals, you should have grievance cell, must have grievance cell or a box where patient can put their complaint. If the complaint comes, please call on the mobile number, tell them that you have received the complaint, you are taking cognizance of the complaint. Whether you do anything or not is immaterial. You have to show that you are doing some action. Your interest in patient's grievance need to be seen at least to the minimum. And if some of your staff has really misbehaved, you have to punish the staff. If one of your doctors has not attended the patients in time, you have to sound the doctor, because finally your hospital is going to lose the reputation, and this breakage of glasses and breakage of the vehicles is going to happen in your hospital and not at the residence of that doctor. So don't spare anybody if he is not communicating well with the patients. You must have transparent bill. Don't give bill as a package. Give the itemized bill. Tell them what is costing what. Even if there is a package for a particular treatment from the insurance, you tell the patient why it is costing so and so. Let them have an opportunity to challenge some part of the bills. If they are saying that this should not have cost this much, discuss this with the patient. If you want to reduce it, but see that reducing 1,000 rupees in bills is not going to cost you as much as they breaking your glasses for 25,000-50,000 rupees worth. So please remember that it is very important to discuss with the patient. You must have effective communication. You give effective treatment. If you cannot treat, it's all other experts. I cannot treat every patient. I am not a neonatologist. I used to treat neonatology patients when I started my hospital 30 years ago. I had incubator, I have phototherapy, I have done exchange, at least 20-25 exchange transfer in the first years of my hospital. But after that, I realized that this is a different ballgame. I don't have the kind of staff that is required. So I started sending those patients to institutions. Good, because finally I realized that I'm not getting financial returns as much as the efforts that I'm putting in. And now that my practice has settled, I don't need to take risk beyond my abilities of the hospital setup in which I'm working. File FIR in case there is violence against you. So strong deterrent law is required. Maharashtra Act needs to be amended, and we have to have diffusion of medical accident somewhere in the law. There should be healthcare protection guidelines by the government. Complaints should be filed by the patients as well as medical institutions and persons against perpetrating violence. There should be a list of patients who create violence, list of doctors against whom complaints have been filed substantially. Doctor-patient relationship improvement committee should be there. Healthcare protection fund should be there. All these recommendations are given. There is a role of community, increased medical literacy, health insurance, effective communication with doctors, nurses. Today, some patient comes to you with a child. Just ask them whether they have insurance for themselves. Forget about the child, whether they have insurance for themselves. You are not insurance agent, but tell them that get yourself insurance covered, at least for 5 lakh rupees, which is minimum that is required. Even if the person coming to you is 23 or 25 years old girl, she should get insured. She'll get at least premium, and you should inform them that they should take Mediclaim insurance. And you have to tell them about limits of medical sciences also. In addition, when you have to file FIR, please see the handwriting on the FIR. The police have filed FIR only as per IPC. We have gone to the police and told them that file FIR under this Act for Violence Against Doctors, which is 2010 Act of Maharashtra State Government, of which there is Section 3 and Section 5, which should be applied, which will at least give 50,000 penalty and 3 years imprisonment to the person who is assaulted. So you have to be sure that these complaints are filed with proper sections of the Act on the complaint. When you go to file complaint against violence, and when somebody files complaint against you, you use the sections of IPC which I have told you from 80 to 92 and tell them that these sections are applicable in my case because I have not done anything wrong. This is because of medical action. So in Bombay, court grants bail to 30-year-old who beat up doctor after sibling's death, and the patient's advocate said, the relatives, the patient's the relatives advocate said that sir क्या करे मेरे client का भाई मर गया और उसका माथा घूम गया तो उसने एक झापड़ लगा दिया. तो कोर्ट से अरे 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 ऐसा होगा क्या, ठीक है माथा घूम गया, ठीक है छोड़ दो उसको, कुछ प्रॉब्लम है, टेक अ बॉन्ड ऑफ गुड बिहेवियर. माथा तो हर एक का भड़केगा ना. In the hospital, what is going to happen? Either patient is going to get killed and go out, or patient is going to die. That is the thing that is going to happen. If everybody का माथा घूम जाएगा तो क्या करेंगे? It's not possible to practice. So we are saying that there should be immediate punishment and there should be deposit before bail, so that they don't enter into such acts. But nobody listens to us. This is the story which stimulated me to file this case. There was an ambulance in which a patient was brought to the hospital, and mob of 100 people pelted stones at the hospital and they burned the ambulance. Ambulance was set ablaze. Somehow the hospital staff was able to take the patient out. But this is a mob mentality. They will do anything. And therefore, I filed this PIL in Bombay High Court to improve State Act for Prevention of Violence Against Doctors. And now we are trying to get it from all states, since Medicolegal Society of India has got members in all states. We have got to act change in Karnataka state. It is now best act in the country. We're trying to do it in Gujarat. We're trying to do it in Madhya Pradesh, and gradually we'll spread it all over the country. So we are conducting this training program for law and medical professionals. LAMP 1, we had 32 participants. LAMP 2, 45. LAMP 3, 56. LAMP 4, 23. LAMP 5, 29. And LAMP 6 has got 34 participants in collaboration with Vishwakarma University, as well as Indian Academy of Pediatrics, Pune, and POGS, Pune. So we will be filing various applications in the court and trying to do well for the medical community. But we need your support, for which I have come here personally to congratulate you all on this day of Medicolegal Day. And now, if we have some time, we may discuss about some medico-legal issues. Before that, we can take some questions. Let me check whether there is anything in the question box. Thank you for congratulating me. You can post your queries and I will answer some of them with medico-legal inputs for all of you, or we can just talk on something else also. How much time I have consumed? I have consumed.
We still have 10 minutes more to go.
Right.
Excellent section, Dr. Raju Joshi. It's an eye-opener for all the medical professionals. And I'm sure it's the need of the hour for all of us to know what is the Medical Legal Protection Act and how should we utilize that. And for that, we should be aware that this kind of situation might come in your practices, and you should always be ready with all possible solutions and situations. Thank you, Dr. Raju Joshi, for an excellent session. If anyone wants to ask question to doctor directly, you can unmute yourself and you can ask to Dr. Raju Joshi. Otherwise, I'll post on your behalf.
Yeah, there is some question. Shruti is asking whether what is telephonic consultation.
So
right?
what is the medical legal view towards the telephonic consultation?
See, now before epidemic or pandemic, the court had clearly stated that no consultation should be done on telephone without examining a patient, and that was considered to be a crime. After pandemic, when this epidemic came up or pandemic came up, the telemedicine practice guidelines have been brought in by the Government of India, Ministry of Health and Family Welfare. Now, this guidelines state that telephonic conversation or telephone consultation is legal. However, mind you, whether you are giving telephonic consultation or otherwise, the legal liability of the doctor will not change as respect to treatment of the patient. So if you have not understood what the patient is suffering from, please tell him come to my hospital. If you have clearly understood, then you can give. So I'll give you a simple example. You have seen the patient, you have investigated the patient, and the patient has gone home with the prescription, and then the patient calls you, sir, uska fever nahi kam ho raha hai, kya karu? Then you will say that, okay, now increase the dose or put something else or change the drug, whatever you want to say. You know the diagnosis. You feel that there is no harm. But now, after this advice, the child throws a convulsion at home, then the patient will say that doctor did not give me proper advice. That is especially in pediatric patients, because in first 24, 48 hours, you may try to control, but just the febrile convulsion may crop up. So you have to be, really aware of what is going to come your way. It is not illegal to give advice on telephone now, but the legal responsibility of the consequences of treatment that you advise are on you and not on the patient. You cannot say that patient did not come to me, therefore I am not responsible. You have given advice. Now I have got much bigger issue. Just now we are talking video conferencing, right? This is a technology platform in between you and me. Let's talk about telemedicine, not on telephonic, but I will talk about telemedicine. This electronic platform depends on the bandwidth. There will be some people who may not be able to join today's session because of the bandwidth issue, they cannot connect. There will be some people who will be able to see my image very clearly because they have got very excellent connection. Same thing if you now are using for treating a skin disorder. Let's forget about pediatrics, but we have these rashes of different diseases, and dengue rash is different from measles rash. And if you want to diagnose measles or dengue based on your image on the video conferencing, and you're not able to judge that properly because of the technological aspects of the resolution of the camera being used by the patient, as well as the resolution of the screen that is on your screen, and the color difference that is there between the two situations. And you may, think that this is a measles rash and not dengue rash. You may falter. So if you diagnose based on this image and you give treatment, you are responsible. Therefore, the consent that has to be taken by the doctors that this technological issue may make some changes in the diagnosis. And if you are not confident of the diagnosis, you ask the patient to come. You don't care whether the patient can come to you or not. You say that you go to the nearest doctors. I am not giving prescription. You are losing 300, 400, 500 rupees over consultation. That is fine. You will lose 5 lakhs, 10 lakhs in paying the advocate's fees and 50 lakhs in negligence suit. So better to, not to earn 500. Not earning 500 is, less harming than losing to the lawyers and to the litigation cases. So every time you are doing something beyond your capacity, for example, investigations. We always think that investigation is jarurat hai kya? I mean, we know the thing, but you don't spare patients money. You let them spend from their pocket. You advise, let them not do it. To be honest, since you are a pediatrician, what I am doing, I'll tell you honestly. I write on the paper, hemogram plus plain bulb for any additional test required, and hand over that prescription to the patients. I tell them verbally that 2-3 दिन में रुको, बुखार कम नहीं होता तो ठीक है, नहीं तो टेस्ट करके लेके आओ. Okay. If the patient comes back tomorrow says that you did not advise anything, I'll say आपके prescription में लिखा हुआ है hemogram करो additional test मैं बताऊंगा. You did not do it. What can I do? So you have to put the negligence into a contributory negligence by the patient rather than they alleging you as a negligence. So every prescription I write, I put this hemogram, I write plain bulb for additional test required, and I say that come back after 3 days with reports. So I am protecting myself in every prescription that it should be practiced in the blood because we have to protect ourselves. We can tell the patient 2-3 दिन में बुखार जाएगा, don't worry, अच्छा हो जाएगा बेटा, कुछ problem नहीं है. लेकिन बेटा अच्छा नहीं होता है तो you are also going to be in a difficult situation. Therefore, what I suggest is be safe when you do the practice. Any other question?
In a similar line, Dr. Vasant Dhamal is advised, same question. whether the online prescriptions and the consultation are advisable. I think you have answered that as well.
I answered that. Now we talk about consent. Now, just remember that consent is the most important document. I will not go into the legalities of it. Just remember that the consent has to be taken from every patient, including for admission as well as treatment of the disorder. And you have to write what are the risk factors which are involved in this particular disease or treatment, and all that has to be written down in the paper. We said that the consent should be patient specific, consent should be patient comorbidity specific, consent should be patient comorbidity control specific, consent should be hospital specific, consent should be hospital facility specific, consent should be doctor specific, and consent should be disease specific, based on which you are going to create a document which will be having legal sanctity when it comes to court, that you have taken consent. One case, very famous case of Prabha Manchanda, I'll just describe. In that, we all feel that patient should not be put under GA for 2 times, 3 times. You do surgery, and then something else is required. A diagnosis copy was done, and the gynecologist found that the patient has got endometriosis, and the uterus will have to be removed sometime or other in future. So he came out, talked to the mother of the patient, talked to the husband of the patient, and they said, okay, anyway, you have to do it now. Remove the uterus. And the woman said that my body, you did not have right to remove my uterus without my consent. And even if you have done it in good faith, I have lost opportunity to produce child in future. And the case went up to Supreme Court, and Supreme Court said that yes, what she is saying is right. However, it could have to be done sometime. But doctors should not do anything beyond the consent which you had taken. So consent for diagnostic laparoscopy is not a consent for diagnostic hysterectomy. So a nominal penalty of 25,000 rupees was awarded to the patient. But fortunately, at that time, these lakhs and crores of rupees of penalties were not given. But the principle was set that consent has to be taken specifically for a particular problem. When pediatric practice, especially, what happens is the diagnosis may keep on changing. You may start a patient with something, and then you say that no, it's a fever of unknown origin. Then you investigate further and investigate further. And I had patient in my hospital for 21 days when fever was not responding. So after about 12 days, I got panicky. I went to my guru Ajay Joshi sir with the patient. He examined the patient. He said that let's see now, change this. So I changed the antibiotic. Patient did not respond. Then I went back on 15 days. He changed this. Patient did not go to the cephalosporin, go to the third generation. So on 20th day, I thought that I have to do something out of the box, and I gave the patient this ciprofloxacin and gentamicin, to which we all know that the enteric fever does not respond. And on 22nd day, the patient responded. So I went back to Ajay sir. I said, now the patient has responded. He said, good. Third generation cephalosporins have worked. I said, no, sir. Third generation has not worked. Ciprofloxacin has worked. Then we had a discussion in his house, and then most of the people having similar patients, they gave ciprofloxacin and the patients recovered. So you don't know how the situation will be there in the market. I can give you one example. There was a patient of clear-cut enteric fever in my hospital, in my clinic, and then I sent for Vidal negative. At that time, there was only this tube test. I sent for Vidal after 3 days again, Vidal negative. I sent for Vidal after 3 more days to private pathologist, as well as I took sample to Sassoon Hospital. From Sassoon Hospital, they reported a Vidal to be 1 in 2,400 positive. I went to the pathologist. I said, sir, you have given negative for 3 times. The patient is becoming more and more toxic. Vidal is negative from your reports. Vidal is positive from Sassoon reports. He said, wait a minute, I got 6 Vidal samples for Vidal in my refrigerator. Let us all go together to Sassoon Hospital. We went to Sassoon Hospital, and 4 out of his 6 negative were positive. Then he realized that his test kit is faulty. This happens. We have to be vigilant in our practice. We have to be careful. We have to be confident about what treatment you are doing, what clinical examination you are doing. You have to be confident about your knowledge, and you have to be confident about your sincerity in seeing the patient. That will all help. See each patient as if he's your relative. See each patient as if he's your own child, especially in pediatric patients, and you will do well in your practice. That is, I am sure with my experience of about 30 plus years of practice, I passed MD pediatrics in 1987. From that 35 years I passed, or maybe more.
There is one more question from Dr. Bharti Khainar.
Yes.
Please comment on patient sharing investigation
Good
report.
morning, sir.
asking
Can
for-
I ask a question, sir?
Yes, please. Please go ahead, Dr.
This is
Prabhu.
Dr. Prabhu, sir. It was a nice session, eye-opener, sir. I would like to ask a question regarding the prescription. Like, is there any model, sir? Any pattern to be followed for the prescription given? And what all pre-implementation can be given for safety of our doctors and awareness for the patients?
Basically, what we should do is, as per Supreme Court rulings in many cases, you should write in capital letters about the drug. Doctor's handwriting is a joke everywhere. Only pharmacists can read it, etc., etc., etc. There was a joke also that a doctor wrote love letter and then the girl could not read it, so she went to the pharmacist. And we are subject to that kind of jokes. It should not result in having a negligent action against us. Therefore, first thing is please write in capital. If you have a computer system, please print prescription on the computer. It will be clear what you are giving. So there is no rule as such, but there are remarks by the Supreme Court that doctors' handwriting should be improved. National Medical Commission should do something about it. And NMC guidelines have stated that doctors should write in capitals at least minimum. Then there are issues about generic medicine and branded drugs. We'll not get into that. We'll talk about it some other time because that is a major thing. But you should try to write the content of the drug below the branded name. Ampoxin into bracket ampicillin plus cloxacillin, something like that. All right, augmentin into brackets this and this, like that. You amoxicillin plus clavulanic acid. You have to write that into the bracket. Let the patient buy clavum instead of ocpin. It doesn't matter. Or some box clav instead of augmentin. Doesn't matter. You are not responsible for it. You have to tell the patient what is. If the patient gets for say 50% price, what is their problem? As long as they are using branded medicines, at least we should not have any issue. If they go to generic medicines and they don't get cure, you can say that I told you to buy this drug, you bought this drug, what can I do? But then there is altercation with the patient, there is a fight with the patient. It is uncalled for. It is uncalled for. That is what we are talking about in generic medicine case in Supreme Court, that only 1.5% cases drugs are tested in India. At least improve this testing to 15%. Then talk of generic medicine. Cost is not the only criteria, cure is the criteria. At least from the doctor's side, doctors will be found to be negligent if the patient is not cured. And then I have to prove that he used generic medicine. Then I have to go to the judiciary and wait in the queue for 20 years, 30 years. That is not what I want to do in my life. I leave my practice. I have said in Supreme Court that after age of 60, I have stopped treating serious patients. He said, what nonsense? I said, stop treating serious patients. I'm sending you to government hospital. I said this in the court. He said, how can you do that? I said, why I cannot do it? I have given as per Paramanand Cutter, I have stabilized the patient and I sent my patient with my sister with oxygen cylinder to the government hospital and I handed over the patient. After that, whether patient dies or not is my responsibility. He said, doctor, what? How you can say that? I said, you are not protecting me. How can I protect the patient? Finally, I am the conduit to treat the patient. I am going to use my expertise and experience of 40 years or 30 years of practice. I passed MBBS in 84 or 82 rather, 83 I completed my internship. So 40 years I have been working as a doctor. If you don't want my experience to be utilized for the patients, I'm sorry about it, but you have to protect me. But very few people will go to court and talk this language because I know that without talking this language, they will not understand. So we'll do it. We'll fight on their behalf. Support us.
So there is question as well from Dr. Bharti, and I mentioned to you just before
please,
whose question. Comment on patient sharing investigation report asking for opinions and treatment.
Don't do this on WhatsApp. If you are talking about WhatsApp, don't do it on WhatsApp. I'll tell you the reason. Patient has got the report, we'll take photograph and send it to on WhatsApp. We'll see the report and send the prescription on WhatsApp. Right? Story over. Then what you have in your record? Nothing. What patient has in the record? Everything. If the patient goes to the court, you don't have anything in the record, you will delete. As your mobile phone fills up, you will start deleting. and you don't have anything, neither your prescription nor your report. If you want to do practice using WhatsApp, what I will suggest is every report comes to you, send file to your email address. Send file to your email address. Create one more email address for your such reports. 15 MB space, Google is giving you free of cost. Keep on sending those files to that email address from your email address. So at least you have some backup of these reports and some backup of your messages. Even if you do that much.
Similar line, we have a question on medical records. How long should we keep the medical records for OPD as well as IPD?
For OPD, 3 years. For IPD, 10 years. That is what is said. But for pediatric patients, mind you, 3 years after the patient becomes major, that is 21 years of patient's life. So your patient is 5 years old, you have to keep the record for 16 years. Your patient is 10 years old, you have to keep the record for 11 years. Because there is something called as a concept of limitation period. Limitation period starts when the patient can be able or can understand something wrong was done to him by somebody. So at the age of 18, patient becomes major. He will understand that a doctor did not treat me properly for pyogenic meningitis, which I had age of 5 years. And then he will have 3 more years to as a limitation period to go to court. So before he becomes 21 years, he can file any time. Before that, his parents can file any time. So pediatricians are worst as far as the medical records are concerned. Keep records for 21, for at least 50 to 20 years. I have now recently trashed records of 10 years of my hospital, first 10 years of my hospital, recently. Our last 20 years I have with me.
So there is one more question from Dr. Shahjit Taur.
Yeah.
In your previous slide, for initial slide, you had mentioned that in a cupboard you have that paper spray.
Yes.
So the doctor is asking what type of weapon should be placed in consulting room for protecting oneself.
Pepper spray is good enough. I'll tell you, one of my urologist friend told me that he keeps that vacuum with the trocar. No, they use surgical vacuum. Post surgery, they keep that vacuum drain, which has got a trocar in the to insert it in the abdomen.
Yes.
So he keeps that in the cupboard. So he said that anybody can say, "ये मेरे हाथ में आ गया, मैंने लगा दिया उसको to protect myself." So this is between you and us, not to be recorded, told to anybody, but you can keep anything like that in the cupboard, whatever you want. If you want to protect yourself, you protect yourself. Do what you like. You should be able to show that you try to protect yourself.
And whenever the incidents happen, always use the word accident. Always use the word
Always
accident.
use the word accident. Always. You say
That
it's
is high.
accident. Let the other side prove that it is negligent. Because onus of proof of negligence is on the patient. Onus of proof of accident is on you. You will say, I did this, 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 but still patient died. There was sudden cardiac arrest. Patient came into shock. We get septic shock patients, right? So many of them. We are not there to kill patients. We are there to treat patients, but we are there to save ourselves also. And that is how we should use the knowledge. I use this term always. There is a skewed knowledge. Skewed knowledge means you have all the knowledge in the world about pediatrics, and the patients have zero knowledge about the world in pediatrics. So use all your knowledge to protect yourself, as well as use all your knowledge to treat the patients. But the patient is going to come back to you that you are negligent, you did not give proper care, your lift was not working, your staff spoke rudely, your this happened, that happened. You have to use your medical knowledge, and now whatever medical knowledge I am imparting to you, use that to protect yourself, to defend yourself. And for that, I will suggest all of you should take up this medical legal course that we are offering on behalf of Medical Legal Society of India. It's not bragging about myself. 200 plus doctors have been trained. For every session, 25 people come for MMC credit point, and afterwards they join the full course. Because we are giving value. 12,500 rupees is nothing for everybody of us who is practicing for pediatrics for 5 years. 12,500 rupees is nothing. Out of which we are hardly making a small profit of 2,500 rupees, which we are using for the cases which are filing in the High Court and Supreme Court. Charity Commissioner asked me that what you are doing, you are making money out of, this is a charitable trust. and you are earning profits in this course. I said, sir, yes, I'm making profit in this course. I'm spending in the court to assist judiciary. So final aim of the course are two aims of the trust. One is impart medical legal education. The other is to protect doctors against medical legal activities or actions. We are filing the case in the High Court. And so I give a list of 10 cases. These are the cases. I mean, finally, somebody sane has to assist the judiciary. We are not, judge is not going to say, give the judgment as what I am saying. He will decide. But I have to give the other side of story also. Generic vaccines, the medicine case, he is saying that punish each doctor who doesn't write generic medicine. I said, okay, 15% drug should be tested. Can you do it? Government of India doesn't have the ability to test it.
So
So
now
we,
the other question somebody is asking, the patient has some history, but they have not disclosed the history, and you try to treat that patient and some mishap happens. How do you protect yourself in this condition?
all right. Now, it's very
Dr.
tricky
Mudola is
question.
asking.
Very tricky question, but very good question also. If the patient is not giving you history intentionally, then it will come out afterwards that the patient had so and so. For example, patient had epileptic seizures earlier, which they are not disclosed from you, and now the patient has got something. Sometime it will come out with, because they cannot charge you for negligence about which they did not tell you anything. Okay, there is some other question in this involved also, is that patients say that don't write this in the case paper so that we'll get insurance claim. The other way around also is there. So you have to write whatever you find in the paper. Patient has history of smoking, patient has history of alcoholism. They say don't write. If you don't write and the patient dies of hypoxia, they will say a doctor is negligent. The patient has gone who has said that don't write. The patient relative will say our patient was non-alcoholic, non-smoker. You have written on your case paper. Now how has patient died? So you have to be very careful in taking history. Patient has not given history. If to the extent, in spite of your asking question, you have written no history of so and so, no history of so and so, no history of so and so, you have asked and you have documented, that means they have not given the history. If you have not asked for that history and you are saying they have not given, then the ball is in your court. Why did you not ask? Therefore, we have to ask no history of family history of diabetes, no family history of hypertension, no family history of this, no family history of, no history of illness in the surrounding, no history of malaria in the. I mean, this is theoretical, but finally courts will go on the documentation. So you have to have a standard protocol of writing history, especially no history of this, that. It is essential. Now it is very difficult to do it in OPD. I fully understand.
Dr. Vinod Shelar is asking, you have mentioned something about do not practice neonatology. How about what does law say about pediatrician practicing neonatology?
When I started practicing, there was no DM neonatology. Okay,
So,
we were all pediatricians and neonatologists all combined in one.
correct.
Now there is DM neonatology. So you will be expected to send patients to people who are qualified, or at least centers. Even if there are residents in neonatology department who are MD pediatrics, who are doing DM, they will be considered as trainees, but still they are under supervision of a DM neonatology. Therefore, you should not go beyond your qualification. Classical example is a general surgeon who did urological surgery was taken to task by the court, saying that you should not have done this. He said, sir, I had trained several urologists in my career. He said, so what? You don't have MCH in urology. Now the thing has happened, patient has got a problem, you have to suffer. It is unfortunate. But like, for example, my teacher, Ajay, she was not a neonatologist, she was MD pediatrics. He had trained us to treat neonates at that time. We had treated for 10 years of my life. Initial hospital, I had treated neonatologists. After that, DM neonatologists come, I send the patients. This you have to remember that the knowledge is going to expand, knowledge is going to change. We are going to be, having ENT surgeons of left ear or right ear. That called specialized is going to come up. There are, cochlear implant surgeons, then anterior chamber of eye surgeons, cataract surgeons, posterior chamber surgeons, retina surgeons. Nobody should interfere in someone else's specialty or super specialty. We've got adequate patients of our own specialty to treat, and adequate source of money from those patients. So why to indulge into practices which are not qualified?
Our president, Dr. Manoj Jhalte, would like to ask if we are keeping our records with the online company, like you're maintaining the electronic medical records, and the company has stopped functioning, the record is gone. So, what should we do in these cases? I mean, where do you retrieve the records from? What do
So
you do?
now, ideally, if the company has closed, they should give you a notice, which has happened just now. I have got two pediatricians who are using software from some company, and they have sent them notice that we are going to shut down on 31st of March. So you download certain things. Now, if you download certain things, the story is they are downloading the data in Excel file for 1 year. So it is very difficult for, say, pediatric patients coming to for 10 years. How do I go back to the history? So they will have to get new software from new software company and upload all that data into the system. And if all of us are suffering from similar problem, contact me. We'll talk to the software guys. We'll get the data and get the software on our server. Medicolegal Society of India will be definitely willing to help in that regard, because having my background in IT, though I'm no more working for IT in India these days. I have got some collaborators in USA and UK. So I have stopped selling software in India 20 years ago, to be very honest, because my
So you see,
experience of
Dr. Rajesh Joshi is an expert in the healthcare informatics also. You have seen that you are very dynamic in that perspective also. So
yeah.
maintaining the records and the healthcare informatics. I think that is
Just
one of
now, there
the
is a major problem regarding this digital personal data protection rules that have come up for public domain. And they are saying that doctors are data fiduciaries and they should give the data.
correct.
Now, classical problem for pediatricians is pediatricians are working for 12 years of the patient's life. And they're saying you should delete data after 3 years. So we are saying that that continuity of care has to be there for pediatricians, because vaccination, all those things have to be there at least till 12 years. So there are so many gray areas which we'll need to sort out, and we are working on it. We will be focusing on it, and if any pediatrician is facing any problem regarding the software under closing down the shop, please call me. We'll do something about it.
Great. Thank you so much for offering that help, doctor, because we are hardly anyone to look at for this particular problem. So we know that Dr. Rajesh Joshi is a point of contact for getting all these.
We will try and help you 100%.
Thank you so much, sir. And the last question from the session is
Dr. Pramila Menon,
yes.
are you the one who was in MUHS?
Dr. Pramila. Is she there?
No, sir, I am not there. Happy to know that you have started your medical legal sessions.
How are you,
That
ma'am?
is, sir.
How are you doing?
Yes, I am good. I am with the Dr. D.Y. Patil Medical College now.
Oh, great, ma'am.
So
We
happy
had
to
good
see
time
you.
in MUHS, long
Right,
time ago,
yeah.
2015.
Yeah. I think even we can have something in D.Y. Patil also, sir.
Let me know. 100% I'll be there.
Yeah,
So there's one
Thank
more
you,
question
sir.
on the YouTube live. We
Nice
have one
meeting
more
you, ma'am.
question. Yes.
Yes.
Yeah, same here, sir. Same here.
YouTube live. What is your take on the consent for vaccination, sir? Consent
You
for
must take consent for vaccination, and in that consent, you give what I'm doing. I'll tell you. Just a minute. Let me get a file from my hospital. Sister, there a file there, apne likna. What I had done is, on my file, I have given information of all vaccines to be taken, and that this vaccine can cause this damage, and there is a place for patient to sign. On their file itself, that signature is there. So that record is with them, that signature is with them, everything is with them. So when they will go to court saying that doctor has given this vaccine and something has happened, then the patient and let them produce to the court that we have given consent, then there is no case against me.
great. And the last question from the session is should be the indemnity cover for each pediatrician? What is the indemnity cover?
Minimum 50 lakhs, if possible 1 crore.
Okay.
It doesn't cost much. Now see this. Can you see this?
So it's very blurred, sir. It's blurred, sir. It's blurred.
But let me check. Now it will be little more clear.
No, I think you'll have to stop your background as a blur so that we'll be able to see, sir.
Just a minute. Let me check.
You can also send a PDF on a group, sir, if you want. No problem, sir.
Just a minute. Let me check whether you can remove
On the video side, you just stop your blurring. Yeah, that's good. Yeah, good enough.
That is better, right? There is a vaccine chart which is everybody is doing.
Chart. Yes, and there is a vaccine information and there is a Sammati Patra, consent. Yes.
There is a consent. Sammati Patra. You have to take from every patient. You are saved.
No problem, sir. So if anyone else has any queries, you could directly post here or unmute yourself and ask. I think we had a very good session with Dr. Rajiv Joshi. We got a lot of enlightenment about the Medical Legal Protection Act, and we are really lucky to have you as a pediatrician working on this field, sir. And you're from Pune, and we have really had a great time today. And thank you so much. And I request all of you to kind of enroll to the Medical Legal Council of India. Dr. Rajiv Joshi is kind of a pioneer for that. And please, doctor, guide us on how to register. Somebody is asking on YouTube live, how do we register for the Medical Legal Council of India?
I will send you the details. Please
Yes,
send
sir.
it to all the people, all the fraternity of IAP. I am grateful to you for having me on this program. It is a long time I'm interacting with all the pediatricians. I was invited about 10 years ago to talk regarding pearls of wisdom regarding IT in healthcare. And now today you are inviting me for
Medical
this
legal.
legal aspect.
We'd love that session also to be held from your side, sir, IET, and that is also one of the
Definitely.
hot topic.
Even down the line, I don't know what I'll be speaking on. Maybe Pramila madam will be, I know, asking me to work on genetics again. So probably we can talk on. Now, recently I read something about cell therapy. Are you aware of that? They are taking out T cells from the human body, treating them with the antigens and growing them in the culture and sending them back to the body. Within 3 days, the cancer is getting cured. That is happening in USA.
Yeah, lot of new things are happening, sir. Things are changing. I think it's almost more than 10
It
years.
was there who was working as an IT professional in the pharma company which is doing these clinical trials. So he said, you come to USA, I'll show you all the lab, and this is something future for next 10 years, maybe
Yeah, I know.
10 years down the line, I'll be talking on cell therapy in IAP conference. Thank you so much.
Thank
Nice,
you
nice.
on
Thank you
behalf
very
of
much.
Indian
We
Academy.
have to keep on changing our knowledge or improving our knowledge and changing.
Definitely, sir. Learning never stops, sir. Learning
Learning
never
never
stops. And that's really a great session. On behalf of Indian Academy of Pediatrics, I thank you, Dr. Rajiv Joshi, for such a wonderful session on a Medical Legal Protection Day Act for us. And I also thank Dr. Amol Pawar for being a chief guest and starting the session with the insights on the Medical Legal Protection Act Day. Thank you, all of you, for sparing your time on a Sunday morning and joining this session. Thank you.
I
Thank
request you to send me the link to YouTube afterwards so that I can.
Yes, sir. Yes, sir. YouTube link is already sent. You can subscribe to the IAP Pune YouTube channel, and you should be able to get this program anytime in the future as
Also,
well.
please send me the link so that I will be able to post it to somewhere.
Yes, sir. IAP Pune channel is open for all, and you can subscribe and always see this video. Thank you so much. Thank you, everyone.
Thank you.
for
Have a
joining.
nice day.
Thank
Bye
you.
bye.
Thank you. Thank you.
Thank you. Thank you.
Thank you.
Thank you. We can
Thank
stop
you,
it
ma'am.
and leave. Thank you.
Nice, nice